My name is Victoria Bejarano. Today I'll be giving a speech, an informative speech on post-traumatic stress disorder. These are my three audience that I'll be having today. Again, I'll be giving a speech on post-traumatic stress disorder. Post-traumatic stress disorder is a type of anxiety disorder that can be caused by any incident that's happened in your life. It can be caused by a traumatic event that involves death or injury. Today I'll be letting y'all know, again it's short for PTSD. Today I'll be letting y'all know how it's caused, how it can relate to anyone at any time in their lifespan, what causes they have, and the symptoms of PTSD. Again, PTSD can occur at any age. It can be caused by natural disasters such as fires, hurricanes, and tornadoes. It can also be triggered by other events such as domestic abuse, assault, rape, sudden death of a loved one, plane crash, car crash, and the last one is war. Some examples would be the September 11th attack, Hurricane Katrina, and being abused as a kid. And of course, soldiers in combat. All of these events may be caused by PTSD to some who were involved because of the disasters they saw, the tragedies they saw, loss of friends and loved ones, and belongings that were lost as well. According to the Mayo Clinic staff, there are three main symptoms of reliving events that include flashbacks, reliving traumatic events for minutes or even days at a time, and upsetting dreams about the traumatic event. The second one would be avoidance and emotional numbing, including feeling numb, feeling hopelessness about the future, and memory problems, and avoiding activities that were once enjoyed. And the third one would be symptoms of emotional arousal. These symptoms include trouble sleeping, being easily startled or frightened, and hearing or seeing things that are not there. And the last one would be self-destructive behavior, such as drinking too much or using drugs to soothe your feeling. There are several, and the last one would be treatments for PTSD. Getting treatments for PTSD relieves symptoms by helping you deal with the trauma you've experienced. Rather than avoiding the trauma and any reminder of it, treatment can encourage you to recall and process the emotions and sensations you felt during the original event. There are several treatments that you can use for getting help with PTSD. It can offer an outlet for emotions you've been bottling up. Treatments for PTSD can also help restore your sense of control and reduce the powerful hold the memory of the trauma has in your life. According to doctors, again, there are several treatments for PTSD cure, three of them being cognitive behavior therapy for PTSD. It involves carefully and gradually exposing your thoughts, feelings, and situations that remind you of the trauma. Therapy also involves identifying upsetting thoughts about the traumatic event, thoughts that were destroyed and irrational, and replacing them with more balanced picture. There's also family therapy. Since PTSD does affect both you and those close to you, family therapy can help with your loved ones. It can help them understand what you're going through, and it can help everyone in the family communicate better and work through the relationship. And the third one would be medications. Medications are prescribed sometimes for PTSD. It does help relieve secondary symptoms of depression and anxiety. Antidepressants such as Prozac and Zoloft are mostly used for PTSD. Even though they help you with the secondary symptoms, it doesn't cause the treatment. It just helps you feel less sadness. Again, anything that's due to depression and anxiety. That being said, again, PTSD can be caused by any different situations that happen in our lives at any time or any age in our lifespan. Hopefully y'all got some feedback off my speech. Thanks.